Hello everyone, welcome to this Allan Practice webinar on vaccinations and a bit of a Q&A session. So I'm Dr. Josh and I've got with me Dr. Riz, who we're both GP registrars.
Hi everyone.
And so basically we thought it would be useful to do a bit of a series of these webinars looking at vaccinations as well as long COVID and mental health. And so today we're going to start off looking at vaccinations. Thank you very much for those that replied to our text message earlier in the week. Essentially wanted to get an idea of some of the questions that people might have with regards to the vaccines and the vaccination program. And I'm pleased to say we had a really good response. So we had over 250 responses in the space of 2 days. And whilst we've done our absolute best to try and go through all the questions and answer as many as we can, we appreciate some are very personal and we may not have been able to get to all of them. But hopefully with this webinar today, we'll cover the majority of them. And at the end of the presentation, we'll provide you with some links with further information. And even after all this, if you have any further questions or concerns, obviously feel free to make an appointment with one of the doctors at the surgery. So just to start off with, some of the most common questions were, when am I going to have my vaccine? Now, in terms of how we're doing, we're basically inviting all our patients in accordance to the government published priority groups. And at the moment, we've been given authorization to vaccinate priority groups 1 to 4. And there are a few questions around how we're doing, versus the national progress. And we've actually to date vaccinated nearly 80% of groups 1 to 4. It's important to bear in mind that we only started vaccinating over 70s last week, and within a week we've done 50% of these. So in the current progress, we're looking to finish our groups 1 to 4 well ahead of the government target of the 15th of February. There were lots of questions around, people who have certain comorbidities or other conditions about when they're going to be invited for their vaccine. And as you can see on the list, those aged 16 to 65 who are deemed as at-risk groups with the clinical conditions on the side will be invited when we get down to group 6. Now, we can't really say exactly when that will be because we obviously have to finish groups 1 to 5 first. This list is on the NHS website, and I can provide a link with that at the end and on the website for you to have a look at so that you know when you should be invited for the vaccine. So in terms of other scheduling questions, when will I be contacted for the vaccine? So as I said, we're working through the list at the moment, and as soon as you're essentially eligible, we'll be sending either text messages or calling you. Please bear in mind that you may get this last minute request. That's not because of any disorganization on the practice staff who are working really hard. It's more to do with the supply. So we sometimes only get a day's notice about when the vaccine's going to arrive at the practice. There were lots of questions about when I'll have my second dose after having the first Pfizer vaccine. And essentially, we're having to follow government guidance with regards to giving this after 12 weeks. So when you're approaching the 12-week mark after having your first vaccine, that's when you'll receive a message to come in for it. And there were lots of questions about how progress is going and how we're doing. And as I said, as a practice, we're doing really well. We're one of the first practices in Bucks to actually offer the vaccine. And so how fast we can go depends on really how the supply is. So at the moment, as I said, we're well ahead of reaching our target of groups 1 to 4 by the 15th of February. And I foresee that trend to continue as we go down the further groups.
I just want to add that if you do get a text from us, it will be done with an NHS, quite clearly from an NHS texting service. So if you're unsure or there's a bit of scams going about, then you can always contact the secretary to make sure that it's secure. But it would always be from an NHS texting link on that. Okay.
Definitely. And the vaccines are always free as well. So you should never be asked to pay for a vaccine, is also important to mention. And then I thought it'd be helpful to give you an idea of the actual process and what actually happens when you've been called. So essentially you'll receive a message. As I said, it could be relatively last minute. We're doing the vaccines at the Chalfont Hospital, so over the road, and it's all very COVID secure. We've got social distancing in place. There is parking available. And depending on your choice, you have the option of either waiting inside or you can wait outside. All staff have PPE. And don't be surprised if there are members of the team that you've not seen before, because it's a joint effort with other GP practices in the area. So there may be nurses and GPs and doctors from other surgeries who could be administering your vaccine. And bear in mind that there is a 15-minute observation period for the Pfizer vaccine. So there are a few other scheduling questions which I just thought I'd go through. Someone asked about when we are doing vaccinations for housebound patients. And so we've almost actually finished this week vaccinating our housebound patients. And the reason for the delay was firstly because of the Pfizer vaccine being more unstable and having to be given under much more controlled conditions. We weren't able to do this. So we had to wait for AstraZeneca. There was also a bit of delay about how specifically we can give this in the house. So, but hopefully in the next week or two, we should have finished all our housebound patients. There was also a question about whether the vaccines are being given in the surgery or in the hospital, which I think I've just addressed. Someone asked about how we are tracking compared to other areas in the country. And at the moment, there just isn't this data really for us to look at. All I can do is compare how we're doing against the government target of the 15th of February. And I also mentioned about the 12-week periods, how we'll contact you. It will be via text message or a phone call when we're ready to give you your second dose. And then I thought it would be worth mentioning specifically about the vaccines themselves. There were lots of questions about which vaccine will I have, which one is best. So it's just important to confirm that there are only 3 vaccines licensed at the moment and approved by the MHRA, so the Medicines Health and Research Authority. Those are Pfizer, BioNTech, Moderna, and Oxford AstraZeneca. The only ones we've had supply of at the moment are the Pfizer and the Oxford AstraZeneca. And there is a J&J vaccine, which is a single dose, which is currently awaiting approval. Now, as I mentioned about which one will you have, this basically depends on supply. So week by week, the vaccines we've been receiving has changed. So ultimately, the vaccine that we'll be able to offer depends on which one we've been given by the government. Lots of questions about which vaccine is best. Now, essentially, the best vaccine is the one that you can have the soonest. They've all been shown to have good effect against COVID-19. And essentially, because of the supply and demand issues, our advice would be to have the vaccine that you're offered the soonest. People were asking what the different effectiveness of the vaccines were. And as I'm sure you've read in the news, there is a bit of variation. And I think the main message to get across really, and the honest response to this, is that they've all shown to have a significant positive effect on reducing COVID-19 hospitalizations and infections. And all the studies are quite different, so it's quite hard to compare them directly in terms of how good they are, apart from saying they're all good. And I'm sure with time, as we have more people vaccinated, there'll be more research done into actually being able to compare how good they are with a lot more reliability. And so just some other frequently asked questions that we had. Someone asked, they've already had COVID. When can I have the vaccine and do I really need it? So the advice on this is that if you've had COVID and you've been asked for to have a vaccine, you need to ideally wait 4 weeks until your original illness before being vaccinated. And although having had COVID and recovered, you're likely to have developed some immunity, there's no guarantee that you can't catch COVID again and that it can't be more severe the second time. So our advice would be to have the vaccine if you're offered it. Someone asked, can I take the vaccine if I am on immunosuppressive medications? So medications that affect my immune system. So this may be if you've got things like rheumatoid arthritis, or inflammatory bowel disease. And essentially, in most cases of people being having immunosuppression or taking medications, there currently isn't a reason not to have the vaccine. But if you're unsure, we'd advise just booking an appointment with one of the doctors at the practice to speak about this. And there are currently trials ongoing to assess how good the vaccine is in these patient cohorts, because lots of the original studies didn't actually include patients from these groups. There was lots of questions about the vaccines in pregnancy, and if you're trying for a baby, can you or should you have the vaccine? Similar to the immunosuppression groups, there is limited data on pregnancy due to these patients not being part of the original trials. And so at the moment, the advice is if you are pregnant, you should not have the vaccine unless you're deemed high risk. And that means high risk in terms of exposure, so your work environment, if you work in a clinical environment or in an environment where you're exposed to COVID-19 patients or people, or if you're at high risk in one of the high risk or clinically vulnerable categories, this may apply. But I think ultimately, if you have any worries or unsure, you should speak to one of us. The Joint Committee on Vaccines and Immunisations have basically said where women are high risk, and it's recognised they may have some benefit in giving the vaccine, but it remains a personal choice. Also, if you've had the first vaccine and you've become pregnant recently after, the guidance is that you should delay the second dose until after pregnancy. There is currently no evidence to suggest that COVID-19 vaccines will affect fertility. And as I said, if any woman who's offered the vaccine is unsure, then feel free to review some of the documents at the end of this presentation and the links on the website, and also book in an appointment with a doctor if you want to speak about it further. And now I'm just going to hand over to Riz to just talk through a few other questions that we had.
Thanks, Josh. So one of the questions was talking about, is a half dose better or full dose, or have I had, what type of dose have I had? So this question was related to the AstraZeneca vaccine, and it all kind of began because when they initially started trying to make the vaccine, they were trying to aim for a one-dose vaccine, and some people in the study were, whether it was meant to or not, were given half a dose, and some were given full. Now, currently we are giving full doses, and you will receive 2 full doses. The reason that is from research is because there were much more people in the studies that had 2 full doses, and research is ongoing, but actually it's showing it's not necessarily related to half dose, full dose, but maybe the longer timing between is the deciding factor about how effective the vaccine is. So we're following the government guidance, and it will be 2 full doses that you're receiving, and no half doses. So another question, moving on, a lot of questions about, is it safe to have the AstraZeneca vaccine over 65 years? Is it working? So I think this is because there's been a lot in the media, and it's all been about bit of political stuff going on with Europe and various things. I think it's important to know that it's been approved by the MHRA, and then the European Medicines Agency have also approved it for over 65s. So again, why this came about, originally when Oxford did their trials, they included a lot more of the population between 18 to 55, and that was because they said they just wanted to make sure it was safer in this age before they included the older patients. And so by the time they've included the older patients in the trial, there was a little bit less compared to other trials. Saying all of that, there was still 10% of the trial were over 65, and in these people, it did show that they generated antibodies and there was an immune response essentially in the over 65. So yes, I would say have the AstraZeneca vaccine or any vaccine if you're over 65, and would definitely follow that, answering that question, go for it. Next question, please, Josh.
Yeah, and I'd probably just add that similar to the AstraZeneca vaccine is similar to the normal flu vaccines, and obviously the normal flu vaccine is given to lots of patients over the age of 65 and they have a good response. So logically, the same we think, and the research suggests, applies to the AstraZeneca vaccine as well.
Absolutely. So a lot of questions about the side effects of the vaccine. So your most common side effect, over 60%, will have, whichever arm you're injected in, and it is in the arm that you'll be injected, will be a little bit tender or painful. About 50% of people have headache with this, feeling quite tired. Their muscles might ache a little bit, or just generally feel a little bit unwell. Some people have chills, so they're feeling shivery, but not actually recording a fever. But you do get that small percentage who are getting a fever. And that's about a third of people. Now, the important thing to say about fever is that if it's going on over 48 hours, or it's starting new 48 hours after your vaccine, then we need to be booking a COVID test. And the reason that is because the vaccine takes, up to 3 weeks before it really kicks in. And there's you could always have picked up COVID before or after you've had the vaccine in that critical time period. So if a fever's ongoing and you're worried, book a COVID test. And then the other common side effect is nausea, again in around about a third of people. And this is for AstraZeneca or Pfizer. It's similar side effects for all. And these are the common ones. Now, if, for example, and to add, these last about a week. There's only about 4% of people who have it beyond a week. So the majority, by a week, you're feeling fine. Most people within 48 hours. Now, if you get side effects outside of these, you can report them. Josh, if you just move on. And this is where you can go. So we'll include this link again on our website for you to click on. You can do this yourself. So you doesn't need to be a healthcare professional that does it. Obviously, you can let us know, but it's absolutely fine for you to do this yourself. And you just enter your vaccine in and start your reports. And they're quite happy for you to report any side effects because it's all learning and gives us as much information as they can have.
Yeah, and I was just going to add as well, there's the Zoe Symptom Tracker app, which I'll put details of at the end. And it's basically a research by King's College London, who are now also wanting to track any responses from the vaccine as well, which you can log on the app.
So I had quite a few other questions, which I'll go into. So a lot of questions about the level of protection that's offered, or am I 100% protected? Those kind of questions. So in terms of being 100% protected, we can never say anything offers you 100% protection. And I'll stick by that line with pretty much anything. I think you've got to keep it in relation. So I think Josh has already mentioned, comparing trials or comparing vaccines doesn't help because they're all done differently. We can say your annual flu vaccine that a lot of people have is around 40 to 50, and all of the vaccines currently are well above that. So whilst I'm not going to offer you percentages because it's variable between different trials, and also a lot of the trials are ongoing still, so I think we'll get a lot more information in the next coming months. We would say that it's not at 100%, but it's definitely high and worth having. We had a few questions on allergies. So one was, if I'm allergic to penicillin, for example, can I have the vaccine? So definitely, if allergic to penicillin, can have the vaccine. Sorry, this is what happens when you work in places. So if you have allergies, you can have the vaccine. If, for example, you've had a anaphylactic reaction. Now, this is the thing that concerns people. Now, at the moment, the current guidance is if you've had an anaphylactic reaction to previous vaccines, that's an individual thing and definitely worthwhile having a chat with a healthcare professional about it. But otherwise, if you've been allergic to certain medications, then currently, yes, you can still have the vaccine. There was a question about, will this affect my other medications I'm on? So no, the vaccine shouldn't affect your blood pressure medications, for example, or your diabetic medications. It's safe to have the vaccine with you continuing to take your other medications as normal. Now, a common question that was asked was about strains. And so is the vaccine going to be effective against strains? So it is quite scary when you're seeing in the media all these new strains and things like that. And is this vaccine going to will it work really? So I think the important thing to think of is that a virus has to change quite a bit. So mutate, they say, they use the word, change quite a bit for a vaccine to not be effective. So at the moment, there's every reason to believe that the vaccines will offer some level of immunity, but quite how much is ongoing. So the research continues, and you may find new strains happen, things change, but that's going to be an ongoing thing. In terms of the vaccine and safety with strains. And then I think one of my final questions is it going to be something that's going to be yearly? At the moment, we don't know, but we do suspect that this may well become, a yearly kind of vaccine. So we will see how that goes. Josh, back to you.
Perfect, thanks, Riz. So yeah, I've just got a few other specific questions that I was asked, which I'll go through. So someone asked, just curious to know what happens after the initial 2 jabs for coronavirus. Is that it, or will there be boosters required? So as Riz said, similar to flu vaccine, what we're hearing at the moment is possibly COVID vaccines may be given on a yearly basis. However, again, we need to wait for more research to come through in terms of whether we will have to keep giving booster vaccines. Someone asked, they had their COVID vaccine at the beginning of January, but then had an antibody test 3 weeks later, which came out negative. Should they be worried? And the simple answer is no, you shouldn't be worried about this, because there's no specific antibody test at the moment to check immunity for the vaccines, or certainly is available on the normal market. And even if the antibody test is negative, doesn't mean that you don't have immunity, as is the case with lots of people who've had COVID, recovered, and then have been shown not to have any antibodies. Someone asked, when I have the second vaccine, will it have to be the same as the first vaccine I had, or can they be mixed? And so the answer to that question is, at the moment, all the manufacturers and the government guidance is to give the same vaccine one after the other. I believe there are trials ongoing at the moment to see whether we can mix and match these, but at the moment, we're not able to give 2 different vaccines. And so they said, can we be assured that we'll get the correct second vaccination? So as long as the government guidance stays the same, in that we are having to give the same dose twice of the same type of vaccine, then we'll continue to do that. In the longer term, can you have a different vaccine? Again, no firm evidence on this, but based on how the flu vaccine program works, every year there's different types of flu vaccines available. So just because you've had one year doesn't mean that you have to have the same the following year. Someone asked, which vaccine will we be administering? I think I covered this question. Essentially, this is based on what vaccine we're given, so the supply we have. And for example, someone asked whether we could go for the Johnson & Johnson vaccine. Well, if the vaccine, when it becomes available, that will be one that we'll be able to give. But at the moment, we're not really able to offer a choice, because we don't really have a choice ourselves in terms of what vaccine is delivered. Someone asked about the different effectiveness of different types of vaccines, which I think Riz has covered mainly. I think the most important message to get across is that they're all effective against COVID-19. And we'd advise getting the first vaccine that you're offered. And with time, I'm sure we're going to see more evidence and scientific papers released comparing all of the vaccines when we have more data. Someone asked about being worried because a family member wasn't wanting to have the vaccine, and was worried about how that would affect the rest of the family, or their risk. And so what I'd say to this question is, I'd encourage them to advise, or the family member to get in touch with one of the doctors to talk about, the reasons as to why they're worried about the vaccine. And I think this is quite a personal basis, and it's based on kind of lots of different factors, which we probably have to answer on a more one-to-one level. So I'd advise booking an appointment for that kind of question. Riz mentioned about being totally protective after a vaccine. No vaccine is 100%. So until the guidance changes, we still have to adhere to all the social distancing measures, even after having the vaccination. And then the last question on, in the future, will we be combining the COVID vaccine with the seasonal flu vaccine? Again, the answer to this question is probably, but I think we just have to wait and see and get over this second wave to see what the immunity is like after the vaccines that we have at the moment.
There was just one more question, Josh, that I had was in a clinically vulnerable person had her first vaccination. I was just wondering if she could have her second vaccine sooner than the 12 weeks. So again, we just have to kind of reiterate, this is the government decision that we are following the government guidance with the 12 weeks. So whilst I can appreciate it could be a worrying time for you being clinically vulnerable, we will be sticking to the 12-week unless that guidance changes for us.
Yeah, and I think, you know, reassuring with regards to the studies have shown a good response after the first vaccine, I think.
Absolutely.
And as part of the Pfizer trial, they obviously didn't look beyond the 12-week period. So I guess they don't have the evidence to really say that it's a detriment to delay it. So I think at the moment, we're just having to follow the guidance that we've been given. So thank you very much for joining the webinar today. We'll make this link available on the website for a period of time. But if you have any further, you know, personal concerns or worries that we haven't gone over, I'd recommend having a look first at the resources that we've given at the end of this webinar. And if you still have any concerns, just book an appointment to speak to one of us. As I mentioned, we're planning on doing a similar webinar looking at long COVID, what it is, how you can kind of improve any symptoms and your recovery after COVID. And then also looking at mental health and some of the resources that are available to help at the moment. And then lastly, we both really appreciate it if you could leave us some feedback. And I've left the link here for you to leave a comment or review on the practice website. And I think the final message is thank you for joining and keep safe.
Thanks, everyone.